Hi, everyone. My name is Merrick Schmitz, and I'm a senior here at Bethel College in the nursing program. And today I want to share with you my PICO question. My PICO question states, among ICU nurses, what are the barriers that some face to assess and prevent ICU delirium in patients? A little bit about myself. I am a CNA at St. Francis in the neurocritical care unit. And this is something I would see a lot with my patients, all right? Delirium is an acute and altered mental state that can cause extreme confusion in the patient. And symptoms of delirium include disorientations, hallucinations, delusions, agitation, and sometimes even aggression. It's really sad to see this in patients, especially when the aggression side comes out, because not only could they cause harm to themselves, they can cause harm to staff. And then we have to restrain them, and then they get more confused and they're afraid that somebody's hurting them. So delirium is a very serious thing. And unfortunately, it has a high prevalence rate. Delirium occurs in at least 1/3 of patients in the intensive care unit and 80% of patients receiving mechanical ventilation. And when I saw this, I was shocked because there are things in place that are supposed to prevent delirium, such as day-night sleep cycles and promoting sleep, decreasing stimuli, because the ICU is very scary, a lot with the sounds and the noises and people constantly coming in and out. And it can this is what causes confusion in the patients, especially when things are not occurring that are supposed to prevent it. So that's why I kind of was wondering, why are ICU nurses not assessing and preventing delirium when it has been proven to prevent it? So critical care nurses play a significant role in assessing and recognizing delirium. Nurses provide the most bedside care. Some may think, why don't physicians recognize that? Well, physicians have multiple patients and they only come in for about 5 to 10 minutes just to check in. They don't see them throughout the day. So critical care nurses are the ones that prevent and assess delirium 24/7. So as many of 30 to 40% of ICU patients with delirium experience significant impairment after discharge. So like I said, it may just be a little confusion, right? Well, with that confusion, along with hallucinations, delusions, some of them may gain PTSD after, or some of them may need to go to a skilled nursing facility after, just because of the near fact that delirium has this huge effect on the brain. So that's why delirium and preventing it and assessing it is so important. So throughout all of the research that I had, delirium detection is the hallmark of any prevention or treatment strategy. So delirium detection, so like assessing and using those screening tools to catch it early on and do something about it. Unfortunately, what I found was only 1/3 of nurses and physicians accurately recognize delirium by using judgment alone. So say somebody comes in and Mr. Smith, how are you today? And they are like, where am I? What is my name? What is today? And they don't even recognize their family member in the room. Like, who's that in the corner? Sometimes they may just brush it off, or sometimes they may say, oh, they're just confused, but they need to go ahead and take those actions right away and take care of it right away. So the cues and competency, quality improvement, and teamwork and collaboration are the ones that I picked for this topic. So teamwork and collaboration and quality improvement. So that includes open communication and shared decision making. We need to come together as nurses and physicians and the whole healthcare team and decide, what are the barriers? Like what is preventing us from assessing and preventing delirium? What can we do to fix this problem, and what can we do to make the patient experience better? So discussing and identifying barriers that nurses face while preventing delirium, like I just said, what are these barriers that we're facing every day to prevent ourselves from screening and assessing and using these protocols to prevent it? And we want to initiate ways to improve the quality of care for the patients, and decrease the prevalence, and all of this requires teamwork. We're all in this together. It's not just one person. Not one person is just going to fix this. We need to all come together as nurses and physicians to just fix this issue of delirium. So within the literature review, there were 3 things that I noticed that all the literature stated that prevents us from assessing and preventing delirium. So identifying delirium, like I said, only 1/3 of nurses and physicians accurately recognize delirium through judgment alone. So a study was conducted to evaluate the knowledge and practice of assessing delirium and potential barriers to nurses. So what I found was as education over delirium increased, then the level of knowledge and regularity of assessment increased as well. So a majority of the nurses actually said that they did not feel that they knew what delirium was, or they knew what it was, but they didn't know all what came with it and how important it was. So they stated that they did not have the proper education. So something that could be done to fix this is just adding a monthly education course or yearly education course over delirium, or stating in huddle, like use those assessment tools and whatnot. So education is super important because if you don't know what it is, you're not going to look for it. That leads to screening tools. So medical staff will miss around 2/3 of ICU delirium if a validated screening tool is not used. So screening tools are made for everything, and they are evidence-based, and they usually help nurses and physicians identify things such as alcohol withdrawal or a fall, if they're a fall risk, and there is screening tools out there for delirium, and the most common one is the CAM ICU. What we found was most nurses did not use the validated screening tool, such as the CAM ICU, to identify delirium. Why is that? Probably because of the lack of education. So evidence suggests that there's a lack of education and training related to screening tool usage. Again, with the education, if we educate over what delirium is and the screening tools that go with it, nurses are more likely to do it. If they don't know it, they're not going to do it. The other thing I found was priority imbalance. So the ICU is a chaotic setting. Even though you only have 2 to 3 patients, these are heavy, heavy patients. They're super, super sick, so sick, and they require a lot of attention and assessing and management. So some of the literature suggests that nurses in the ICU setting have a difficulty with balance and setting priorities in the workplace. And then barriers to screening include a lack of medical support and time restraints. Sometimes they feel like they don't have enough time, even though these screening tools are made to be used quickly. Some of them only take 2 to 5 minutes, but still they feel like it's not really a priority because delirium's not that big of a deal. Or they just think, I don't have enough time. I really don't have enough time. I have 2 to 3 patients that are super sick, and I have this and this and this to do. I don't have time to assess for delirium on all 2 to 3. So in conclusion, it is evident that nurses face multiple barriers that intercept them from assessing and preventing delirium. And it's important to assess and prevent delirium, and the understanding of delirium will make a change in the critical care setting. So I have a couple of recommendations to fix this. Educating healthcare professionals is an essential first step in improving of the prevalence of delirium. I mean, it is, as evidence says, as evidence increase, preventing and assessing increases as well. And along with that, they're going to use the screening tools like if they learn the education behind it. Using screening tools such as the CAM ICU for delirium should be mandatory. I feel like it should be mandatory in all of the ICUs, and it should honestly be just a part of their daily assessment. If there was a way to incorporate that in their assessment and their charting, then they're more likely to do it. We need to help critical care nurses find balance in the workplace. Critical care nursing and the ICU is a very, very stressful environment. And yes, delirium is important to screen. However, our nurses' mental health and finding balance and trying to decrease stress is important as well. When you're stressed out, there's a million things going on in your mind, and you're probably going to maybe forget to screen for that. And I also would suggest for further research, more current and recent research regarding why there are barriers to assessing and preventing delirium. It took me a little while to find all of these articles. There's billions and billions of articles over what is delirium and what are the protocols to help prevent it and the CAM ICU screening tool. But there isn't a whole lot on why nurses just aren't doing it, especially with the prevalence rate being so high. You would wonder why is the prevalence high when there are all of these evidence-based practices in place. So thank you guys for listening to me. I appreciate it.